I'm Emma Maxwell. I'm also known as Endometriosis M on social media. I went through 7 years of not being believed by my doctors with the very real pain that I was having from endometriosis. And when I got my diagnosis, I felt it was very important to share my story. And it's been 4 years since my diagnosis, and I now feel comfortable sharing the good, the bad, and the
I
ugly.
haven't been able to get out of bed for the last 4 days.
I didn't know what I was going through. A lot of the time, it's very confusing, and wanted to share my story so that the people in my life could understand better, and then hopefully help other people understand that they're not alone. So early on, my symptoms were very painful periods, very, very heavy periods, irregular periods, a lot of bloating, which really affected my body image in middle school and high school. I would wear like my dad's shirts to school and shorts so that I just felt like I was covered, because that's such a, I feel like, monumental age. And I just like didn't see anyone else around me with bloating that looked like they were pregnant. But a lot of bloating and just very uncomfortable feelings throughout my body. I would get sharp piercing pains with my period, like it feels like lightning. Um and I would get shooting pains like in my vagina and in my rectum, which now makes sense because I had endometriosis in both of those places. So, yeah, there were a lot of symptoms, but I think that those were kind of the basis. And then as time went on, like I would get pelvic floor spasms that travel up to my chest and over to my back and then down my legs, and I lose feeling in my legs and specifically my left leg. Um, and then it got to the point where I wasn't able to leave bed for 4 or 5 days when I was on my period. And it was really hard for me to even get to the bathroom. But again, I normalized it because, like, first there was a lot of shame around it, and I didn't want to talk about it because I was 13 years old and thought that it was embarrassing at the time and didn't want to complain, and always was told that periods are uncomfortable and painful, and maybe I was just being overdramatic. Like maybe I just couldn't handle the pain like other people could. And then at 15 years old, I started to realize that none of my friends were really going through what I was going through. I was bleeding through a tampon, a pad, and my pants within an hour. And I was in school and I was bleeding through my pants, and I would go to the nurse's office, and I was in there so frequently that they were kind of like, you can't be spending all your time here. Like, you're skipping class. It's not that bad. Just be better prepared. I didn't know how to be better prepared. um, I remember being in just so much pain, but I had to muscle through it and would actually get in trouble. Like, I would always be the last in line, and I would actually hold on to my friends when they were running because I would just be in so much pain. I'd get so much pain under my ribs. Um, and then a lot of joint pain and just a lot of abdomen pain. And I went to my primary care at 15 years old and told them, like, this is what I'm going through. I don't really know what's going on, but things seem to be progressing. My pain's getting worse every month. It was already bad at the start, but when I went to my primary care, they were like, okay, well, that's normal. Like, that's just what you go through with your period. Let's get you on birth control. This is going to fix all of your problems. So at 15 years old, I was put on birth control. And from the ages of 15 to 19, I cycled through 10 plus different birth control pills. They just rapid cycled me through because I would go back and I'd be like, okay, well, this is actually making me feel worse it's adding a lot of issues, and it doesn't feel like it's not helping, it's making things worse. So they were like, okay, well, you just need to find the right birth control for you. So they just kept cycling me through and didn't really dig deeper as to what the issue was. I think also chest pain was something that I really struggled with too. I was told that I had asthma, sports-induced asthma, because it would hurt more when I was doing movement, because I played lacrosse and field hockey and loved sports, but I would always get this really, really sharp, piercing pain under my left rib, and I couldn't take full breaths. It just felt very constricted and like a really, really sharp pain. At the time, I was also dealing with chronic constipation, which is something I've dealt with my entire life. But it got progressively worse, and I was not going to the bathroom for weeks, 2 months at a time. And I remember not going for a month and going to the emergency room. And this was probably around 18. 18 was when things really started to rev up, and I couldn't ignore things anymore. I ended up convincing myself that I was crazy when I was in high school, because all of my doctors were like, everything's coming back normal. Like, you just can't handle birth control. And like, they're just side effects, essentially. Like, just kind of like get through it. And I did, because I trusted my medical professionals and thought, like, well, I can't push back on them because they know what's best. Hindsight, you know your body best, always. And medical professionals are amazing, and there are amazing ones out there, but you know what's best for your body, which I did not know at the time. And I was going to my primary care, I was going to specialists like gastros for my constipation. I ended up in the ER, like I said, for constipation. And because I was losing feeling in my legs, I couldn't eat or drink without immense pain. And I was just losing weight so much because I wasn't eating or drinking. I was scared to put anything into my body because I wasn't going to the bathroom and no one was helping me. And I went to the emergency room and they took an x-ray and they were like, we're so glad that you came in. You have stool all the way up to your heart. Like, it was filled up to like all of my intestines. But then they sent me home and they said, drink Miralax. And sent me home and did nothing. So I was going to a gastro at the time, and they told me that at 18 that I would have to live with a colostomy bag. But which can be so helpful for people. And I think that that's absolutely something that some people have to do, but it just didn't sit right with me. I knew that I was going through so much more, and was like, I think I need to like address other things, because I think that this is tied to something bigger. I just had like a gut feeling that maybe that's not the first step for something. Like, I was on a lot of medications like Amitiza, Linzess, and Trulance, the highest doses of all three of those for my constipation, and nothing was helping. Fast forward to 2019, September of 2019, my health was just not in a great spot, and my periods were getting debilitating, and I went to an OBGYN and I talked to him about my symptoms, and he said, I think you have endometriosis. And I kind of laughed at him and I was like, no, like, I brought that up to my doctors before. I don't have it. Because my doctors told me that I was too young to have endometriosis. Like, because I did my own research, and I did, like, Google brought me to that very early in my journey. But then I brought it up to my doctors and they said, no, there's no way. And also, it could not be affecting you in the ways that like you're saying that it is. So I kind of was like, okay, write it off. That's not what I have. So I stopped going down that route. And my OBGYN was like, well, did you have a surgery? I was like, no. So he scheduled me for a surgery 2 weeks out. And then I had a diagnostic laparoscopy where he used ablation, which I didn't know the importance of ablation and excision that you want to find an endometriosis excision specialist to perform your surgeries. But I got my diagnosis and I was very grateful. And then I just had another surgery for endometriosis with an endometriosis excision specialist in January of 2023.
You could just do.
The diagnosis was one of the most validating things that I've ever had. I cried. I woke up from my surgery and I was like, did I have it? From both of my surgeries, because I was convinced with both surgeries that they were going to find nothing, just because nothing was showing up on scans or like x-rays, CT scans, like nothing was showing up for them. So both surgeries, I woke up and I asked, did I have it? And they both said yes, and a lot. And then with my second surgery, they found so much more because I was with an endometriosis excision specialist. But the difference between my first and second surgery is drastic. My first surgery was booked within 2 weeks. It was the OBGYN who told me that he thought that I had endo. And like I said earlier, I didn't understand the importance of finding an endometriosis excision specialist. So again, I'm very grateful that I got my diagnosis because it gave me answers and I really started to understand my body and rebuild that relationship, because I became so disconnected with my body because I convinced myself that I was crazy and thought that my body was just fighting against me and was my enemy, which I now realize that it's doing everything it possibly can to keep me alive. But through that surgery, it was under 2 hours. He used ablation, which is burning the endometriosis, and only looked in my lower pelvic region. So I have one scar up right above my pubic bone. I have one to the left and then one through my belly button. And he found what was obvious endo. Endo can show up in so many different ways. There's a multitude of there can be angiogenesis, which is new veins, or maybe not new veins, but endo's creating abnormal blood vessels. It's blood vessels. And endo can show up as blue or black or brown or clear reflections. And I think that he saw some of it, which was great. But it actually ended up leaving me with a lot more pain after the surgery and a lot more adhesions because, again, he burned it. And by burning the disease, you're not getting to the root of it. The root of it's still in my body. And you just burnt it, and then it creates this sticky scar tissue that's going to make other things stick in the region that's already so inflamed and so in so much pain. So after that surgery, I felt okay for a little bit. I felt better for a little bit, but then things just started to really progress again. So I started to seek help from an endometriosis excision specialist. After that first surgery, I really submersed myself in the community. Like I said, I wanted to share what I was going through so that the people in my life could better understand and better support me. Because it was hard for people to understand how dynamic it can be and how I can do one thing one moment and then the next I'm in debilitating pain, and which is understandable because I'm constantly confused and it's my body and I'm living it. But through the endo community, I learned that it's so important to find an endometriosis excision specialist. It took me 2 years to actually get a surgery date. And I remember my first appointment with him. He sat me down and was like, your textbook endometriosis. Him and his colleague drew me pictures and talked about the misinformation and wrote everything down so I would have a better understanding of what's real, what's not real, common misconceptions out there, drawing me diagrams, talking to me like I'm a human who's going through something and not just a number. And it was just so individualized and they actually cared. my excision surgery, the healing took me about 5 months to start feeling like myself again. And it took me 8 months to start walking upstairs normally.
Go slow.
Through my excision surgery, they found endo on my colon and my ribs.
Lateral abdominal sidewall, and I excise all of that and mobilize then the colon.
I had Allen Masters windows with deep infiltrating endo going through the sidewalls of my stomach. They excised entire sidewalls. They went into the muscle layer of my bladder. I had endo on my uterus. I had endo in my rectum, in my anterior and posterior cul-de-sac. A lot of these are medical terms that I'm still trying to understand. But I just had so much endo everywhere, and they excised it. And like I said, they went and excised entire sections of my body. So it just took a lot longer to heal than I was expecting. My first surgery, I felt like I went back to college after 2 weeks, because that was all my doctor could get me. It was like, you'll be fine in 2 weeks. Like, just go. You can proceed with your normal activities. And I was like, okay, well, that's what the doctor says. And I was feeling a little bit better, but after my excision surgery, it took me 2 weeks to actually start to be able to walk downstairs with my dad holding me holding on to the railing and having a cane. So it was just a longer process, more medications, more support. And then my first few periods after my excision surgery were some of the most painful periods that I ever had, because everything was just still healing and so raw. And again, they had to dig into so much and get to the root of so much that I kind of thought, I knew that my periods were going to be painful, but I just didn't think that they were going to be like that. So they definitely prepared me for my period being more painful, especially through the endo community. I did learn a lot about that. I just didn't know how intense it was going to be. Because they excised from my ribs, that felt like it was burning and on fire. And I remember being in bed and my body would just go into full twitches, because I think it just didn't know how to handle the pain. And then I would twitch so much, kind of the feeling of when you're sleeping and then you feel like you're falling, if you've ever had that. And I would catch myself and jump up, but then because everything was still healing, it felt like things were ripping. They definitely told me. I just didn't really, it didn't resonate how much it was going to be for my periods and just the healing process in general. It can be really hard to describe the pain. I think that I'm starting to understand it more, especially through other people explaining their pain. I'm like, oh my God, yes. Sometimes it's just hard to put words to the pain that I feel like is just there all the time. It's definitely heightened around my periods, but it's something that I struggle with every single day. But I have found throughout the years of trying to manage things by myself, because I didn't get a lot of help from medical professionals, I have found some things that definitely help to make things feel more manageable. It's maybe not solving the problems, but it's helping me get through my days and improving my quality of life. Like heating pads, I have a moist heat heating pad, which from Thermo Relief, I believe. I think I got it on Amazon. One of the best purchases I've ever made. Myopia is one of the biggest and most helpful things that I've ever come across. It's a portable heating pad. They have different versions. I can use it on the front. I can use it on my back. I can use it wherever. And then it has a little vibration setting, which can be really nice to kind of bring blood flow to the affected area. Some days Cramp Cream is a topical cream that I use and swear by and take it with me everywhere. I take the full bottle with me everywhere. which can be really, really helpful for when I do have cramps. I also use it for my Ehlers-Danlos, like when I'm having a lot of like muscle pain or joint pain, I'll use it. I also find that CBD topicals are really helpful. I use one specifically by Pure Spectrum. They have a Recover Ice CBD cream. It's very high potency and it gives like the feeling of biofreeze, which is something that I relied so heavily on for so long. But I feel like it actually helped me a lot more than biofreeze, and it's doing something with the CBD, if that's legal where people are. I know that that's not necessarily always, but I think my biggest advice for anybody going through similar things to what I just spoke about, or just understanding that or recognizing that something in their body doesn't feel normal, and to keep pushing. And I know that it's easier said than done. And if you're being met with invalidating medical professionals or loved ones, family, friends, like it does happen and it happens frequently. Just to remember that you know your body best and that there are people out there that can and want to help you. It's just a matter of finding them, and just, it's easier said than done, like I said, but see a second opinion, see a 10th opinion, see a 20th opinion until you find the care that you deserve, which can be mentally and financially and physically draining, but you deserve answers and you're not crazy. And if you feel something, you know your body best and you deserve answers and care and treatment. And don't gaslight yourself into thinking that nothing's wrong, because I still do it. And I have so many things to prove to me that I'm not being overdramatic and that I'm not making it up. And I know that it can be so hard to remember that when you don't have a diagnosis or when you're going through that with the medical system that we have and being met with invalidation. Just remembering that you know yourself the best. So, yeah.